the community to work effectively together in order to resolve community conflicts, develop initiatives to disrupt systematic inequities, enhance civic identity development, highlight opportunities, and become more empowered to bring about constructive changes in our region. Our objective is to bring you closer to our work by creating shared, deep dive conversations on pressing community issues and the United Way strategic response. So we want to recognize this unique space where we have convened both our donors and community partners. Your presence is most welcome and appreciated. If you have any questions throughout the presentation, please use the chat function, which Isabella's own will be monitoring. When space is presented at the end of the presentation, then Isabella will announce your questions at that time to our speakers. Lastly, engage and have fun. Now, at this time, I'd like to introduce our presenters. James Collins is the director of 211.
Here, Jack.
Julia Goulier is the senior program officer of 211. Jackie Johnson and Raylyn Nelson are both community resource specialists at 211. Next, I'd like to go through the agenda. First, we're going to answer the question, what is 211? Then we're going to address 211's response to the COVID-19 pandemic. We're also going to answer the question, what are 211 callers and community resource specialists experiencing? And lastly, we're going to answer the question, how has 211 data informed our work? We're going to conclude with a Q&A at that point. Now, at this time, I'd like to turn it over to James Collins, who will be beginning the presentation.
Well, thank you, Anthony, and thank you for that introduction. And hello, everyone. It's fun to be able to present today. Thank you for being here on behalf of the 211 team. Welcome to the virtual space, Greater Twin Cities United Way. We're so glad that you're with us today as we share more information about 211. Over the past couple of years, it's been my pleasure to lead 211 on behalf of Greater Twin Cities United Way. 211 is a special program you'll learn more about today. We serve over 90% of Minnesotans 24 hours a day, 7 days a week, 365 days a year. Rain, snow, sleet, and hail, whatever the weather is, right? Our program connects thousands of Minnesotans to community resources, which, as you can well imagine, is more important now in this kind of time of COVID than ever before. Our dedicated team of experienced community referral specialists provide not only a referral, right, information to community resources, but a connection to United Way, a connection to the community at large, and I think probably most importantly, a connection to another person on the end of that phone who cares. Over the past couple of years, we've engaged in several strategic shifts of how we deliver the services, but the impact stays the same. And today's conversation is really going to be about what we've seen in these past few months during this COVID time as we continue to connect our friends and neighbors to the resources they need throughout the state. As you all well know, our mission here at Greater Twin Cities United Way is to create pathways to prosperity and equity for all. And for the 211 team, we say that all of that begins with information and access, right? And that's what 211 does every day. So now I'll transition to our real expert, Julia Goulier, who is our Senior Program Officer for 211.
All right, thanks, James. Thanks, everyone. Hello. And yes, just want to reiterate that United Way 211 is a vital service that connects millions of people to local resources across the country every year. So it is a national tool. It's something that I get asked a lot. People don't even know that it exists. So I hope, if nothing else today, you take away the fact that there is a resource to turn to, that there is this program that is a service for our whole community, and everyone in our community can contact 211 with questions about social service programs and get connected to some of those great local resources that we're blessed in Minnesota in particular to have a wide variety of nonprofits and social services in our state. So thank you for joining us today. And for those of you who might know 211 by another name, we have been around for 70 years in Minneapolis. So we were called First Call for Help. So maybe some people are more familiar with that version of our name. Back in about 2000, we did switch to the 3-digit 211. So just like 911, 411, you can call 211 to be connected to someone. So we'll share more about that, but want to make sure, if nothing else, you know that message today. So go ahead and advance the slide. So we've got, thousands of resources. 211 provides this service for 70 plus years, and 2020 has been a year like no other. So we have, it's been really amazing to watch the 211 team help during this time, during this pandemic, and really respond to the demands in our community, the urgent. All right, can you hear me okay? So we've responded to the pandemic in a number of critical ways that we want to touch on today, as well as we'll be hearing more from some of our phone staff as well, the community resource specialists who talk to callers every single day, that I'm looking forward to you all hearing more of their perspective as well. So at a high level, from the time that we can all think back to March, we were all faced with the uncertainty that, schools were closing down without much planning or notice. There were, businesses being shut down, record unemployment claims. This was a tumultuous time and continues to be to this day a really stressful time for many, many families in our community, and I'm sure many of us on this call as well. But one of the things that we did right away was try to get the word out about 211, because we want people to know that there was a place to call, that there is somebody there to help, and we might not have all the answers, but at least we can be that listening ear, be a place to turn during some really tough times. So we used our social media channels as well as a text campaign to be able to push out information relevant to the pandemic. For example, about mask orders or about testing opportunities, things that we all need to know that maybe we never envisioned we'd need to get information about. And then the other thing that we did, as you recall, everything had to change around how we access our services in our community. And so, we have a staff of 4 people whose job it is to make sure that 211 has updated information, to make sure that we have the details that you need, not just in a name and a phone number, but also what to bring with you to an appointment. What do you need to be eligible for in order to access a set of services? So we try to get all of that information as available as possible, and certainly in March especially, and continues to be a challenge to really pin down all of the moving pieces and so many different changes that were all happening all at once. So that is something that we're always trying to stay on top of. Third, we have certainly seen unprecedented calls, especially those first couple weeks were record-breaking days for call volume, and we did some things to create more efficiencies in our protocols, trying to pull in some backup resources, trying to make sure that we could get to everybody's calls in a timely way so that people knew that there was somebody there they could talk to. Next, we're part of a national network, so it's been really helpful to see and share what we're doing and finding successful, as well as lean on other 211s across the country. So we've been sharing through our own internal networks, different examples, different resources, different ways that all 211s across the country are really responding in this moment. One thing that's interesting to note is 211s have always backed each other up in a time of disaster. If there's a hurricane in Texas, Minnesota or Connecticut can back them up. We've often rerouted calls to help, a certain geographic area that might be inundated. And this was a really unique situation where every 211 in every corner of this country was, all responding to their own version of a disaster. And so we're all working together to see how we can really learn from each other, lean on each other, and leverage some of that great work happening across the country to at least be there for each other. And then lastly, working with our state and community partners. So we have, a great infrastructure that is 211, and especially in a virtual world where it's hard to go in person these days, 211 is a great resource to at least be able to access easily a lot of information all in one place. So one example of how this was leveraged in the very early onset of the pandemic is with Minneapolis Public Schools. So Minneapolis Public Schools reached out to 211 in that first weekend when it was apparent schools are not reopening on Monday. They reached out to say, we are getting overwhelmed with calls from parents. They're wondering, how am I going to feed my child when my child has been receiving food or lunch at school? And if schools are closed, what does that mean for my child? They were reaching out to say, well, if my child's not in school, where can I put, what can I do with my child for childcare? I need to work. I'm an essential worker, or for any other reason, I'm not able to, have my child at home. Where can I find childcare? So we were fielding Minneapolis Public Schools was fielding a lot of questions from rightfully concerned parents. And at the same time, they don't have that infrastructure or that bandwidth to necessarily answer everyone's individual question. So what they did was they provided that information centrally to 211 and then directed all their parents to contact 211. So we were able to answer at scale a lot more questions and have that infrastructure ready to support families in the Minneapolis Public School District to get them connected with some of those resources, while the school staff was able to focus on things like, how are we going to stand up distance learning in 48 hours? And how are we going to make sure that our staff and our students stay safe? So really working with others to see how can we help and where can 211 play that unique role in the community based on the resources that we have at our fingertips. So next slide, please. So with that, one of the things that is great about 211 is, every individual conversation is a person, it is a unique situation, it is something that is dealt with very gracefully by the staff and honoring really that personal experience that people are having. And at the same time, we have a really unique lens on the cumulative data across the community and what each of those individual needs represents when we look at them in the full picture across the state as to what people are calling about, what is happening in our community, and what does that signify as we're looking at trends. So this graph is an example of just volume at this point. So this looks at the past 18 months. And that blue line you'll see are contacts, so the number of people contacting 211. The orange line is the number of referrals. So we count those things a little differently. Typically, when somebody calls 211, they might call about, where can I access my local food shelf? But then as the conversation evolves or there's more information is provided, it sounds like, oh, actually, maybe, there might be an additional need for some employment program, or maybe there is an additional need around housing that can also be addressed in that same conversation. And so typically we have more referrals than we do individual callers because of the diverse set of needs that people have in our everyday life. We're not single faceted. So this looks at or represents the spike in pure contact volume, as well as an even greater increase in the number and type of referrals that people were provided. And so, people who maybe would contact us before with one or two things, maybe are asking for 3 or 4 different types of services, given everything that was going on at that time. So really that gray shaded bar that you see is that March-April timeframe compared to March-April from 2019 just the year prior. So certainly a huge spike, and then things have settled down a bit. Certainly, that was peak, but those needs have not all been resolved. It has not really, there's still a lot of effects of the pandemic that we're all living through, certainly. So that's the kind of snapshot of volume, but next slide, please. What this demonstrates is kind of where did these calls come from? What were driving some of this outreach to 211, and where were people expressing the most requests for help? So housing is that blue line. As you can see, it's always our largest call. That's the number one reason people contact 211 is for help with housing. So that is not new, but as you can see, the spike in that particular area was most pronounced, or very pronounced, because food is also was the highest increase in types of calls. Food is the pink line there, you'll see, and that is really interesting because food is certainly a need in our community, but it is a moderate need in terms of our typical kind of normal 211 call volume. But during the pandemic, it really increased, and we attribute a lot of that to people maybe needing to reach out to a food shelf for the first time. A lot of the increase in volume were first-time callers to 211. We know that the pandemic caused a lot of families to need to, look to their network of resources and try to find out as much as they can to really get connected, because there were needs that a lot of us never anticipated needing to face, or challenges needing to face. And food was one of those areas where food shelves often reported too that they had a lot of first-time visitors to their food shelf. And in particular, even if somebody had a food shelf that they visited occasionally, even those food shelves had to accommodate for the pandemic. So there were a lot of concerns around, how am I going to access this food? My food shelf isn't open anymore, or I can't walk in, or maybe my health conditions prevent me from even going out of my house to be able to access some of those resources. So folks were requesting a lot about meal delivery programs, grocery delivery services that are typically not hot referrals, if you will, or it's not something people ask about on a regular basis. So a lot of new types of needs or challenges presented through the changes in some of our social systems that have relied heavily on in-person interaction. And then certainly the red line and the brown line are both around health conditions and disaster services. Disaster, in this case, is the COVID-19 pandemic. And so we've obviously have not had any calls for COVID-19 in the past, but testing sites, things about, is it safe to travel, especially in those early days, a lot of myth busting or trying to make sure people had the right information about wearing a mask, or is it, what are the latest changes? Can I leave, or do I have to stay home? Some of those questions people had, we answered a lot of those type of questions at 211 as well. So with that, that's kind of a snapshot of the data and how we've been, some of the things that we've been seeing at 211 in this time. But I want to make sure we kind of balance that data perspective with the interpersonal, the real lived experience of our callers and of our staff that are interfacing with those individuals every day. So if we go to the next slide, please. We have two special guests with us today, Jackie and Raylyn, who are some of our community resource specialists with the 211 team. If you go to the next slide, please. These are a few high-level themes that I'll just let you read, but these were kind of some collective observations that we wanted to share with the group today. But really want Jackie and Raylyn to be able to share some of their own experiences and stories as well, to maybe highlight some of these, supplement some of this information that we've shared to really help paint that more full picture. So with that, welcome Jackie and Raylyn. Are you off mute, or can you come onto the screen?
Yes. Hello, everyone. I'm
Hi.
Raylyn.
This is Jackie.
Hi there.
Welcome, everyone.
Thank you, guys. So, Jackie, do you want to maybe just start us off by explaining a little bit about, what is it like when somebody calls 211? I know there's, we've all had our fair share of, call center experiences, some for the better, maybe some for the worse. But what is that really like for somebody who might be hesitant to call or reach out? What kind of experience does somebody have when they call 211?
Well, when people call, we always are asking them what are their needs. And most people will start telling you the story of what their situation is. If someone's hesitant, you might have to just, kind of walk them through that unease and help them feel like they're being heard and that they're important. And then we look at what are their needs. We will ask clarifying questions so we make sure that we're searching for the right thing. And it's always interesting because you're hearing, I mean, it can be the same type of call. You can have, somebody calling for rent and you get 3 calls in a row like that. But the stories are all different. The circumstances are different, but the needs can be the same. So, then, we're going to look up those resources. We're going to provide the information. And you did kind of touch on the fact of what, we don't just give a name and a phone number, but we also have like what hours are available and what documentation they might need. We can go over the eligibility to make sure we're giving them a viable, potentially resource. And, then we also try to like go a little deeper. So when somebody's telling me about their situation, if they're looking for help with rent and that they mention that they're low on food, then we'll deal with the rent thing. And then I'll come back and say, okay, I heard you mention, that you're low on food, or this is an issue for you or for your children. And so, do you have time? We can explore that and see what resources we can find. So, we try to make sure we're doing a deeper assessment and trying to take care of as many needs as possible without overwhelming somebody at the same time.
Mm-hmm. Yeah, thank you for walking us through that.
You're welcome.
Raylin, how has the nature of your conversations with callers, how has that changed in the onset of this pandemic since March? What have you noticed?
Noticed more anxiety, exactly what that says. Callers are more anxious, or maybe more chaotic in their life. Just people that have never called 211 before or are new and don't understand or know what we actually do. We walk them through, like Jackie said, we'll let them know, we're an information and referral line. We do help with community resources, with, health and human services. A lot of times, those people are a bit nervous, don't always want to like tell us the deeper story, but eventually, I mean, we can do a deeper assessment. They know that there's a compassionate person, and then they're willing to share more detail about their situation, or, so definitely more anxious. There's been a lot more priorities as well for each call. I mean, they're all different, but, whatever someone prioritizes, we try to get them to focus on, one bite at a time. How do you eat an elephant? You take one bite at a time. So we try to get them to focus in on, what's more important to them and their family, and then from there we, like Jackie said, make that assessment. So
Mm-hmm. Great, thank you. Jackie, is there anything that you would add as far as kind of how you've experienced the conversation shifting over these past few months?
Well, I think being attuned to the fact that you can hear the fear and anxiety in someone's voice when they're telling you about the situation. Sometimes people, they'll talk a lot faster. They're so anxious that they don't actually hear what you're saying. So then, our role is to try to calm them down so that you can get them the information and they're hearing it and they can process it. And sometimes you have to help them with processing what they're given, because they might say, I can't go on that day to that food shelf. You go, okay, well, let's look and see if we can find something that works on a day that works for you, so they know there are other possibilities. And that can be with callers that have called us before, or for new callers too.
Mm-hmm. Yeah. I know, I think that's one of the things that a lot of these services sound straightforward, but then when it comes to juggling, other barriers of transportation or work schedules or proximity or just resources available in certain areas, a lot of things that might be available in a downtown but not in a suburb or vice versa. And so trying to really help work with people on navigating that broader system to make it more manageable or bite size, as you said, Raylin, to really break it down and help people with that, because it's a lot, especially when you're, in that crisis mode or feeling that stress in your personal life, to be able to navigate some of those systems. It's not necessarily made to be always the easiest system to navigate. So, yeah, thank you for sharing that. Raylin, do you have an example to share, or could you share an example of a call that maybe has stuck out to you? Certainly, obviously not personal details, but something that maybe is a conversation that you had that really has stuck with you from these past few months.
Yeah, I can think of one particular. There was a lady who called about testing sites. She was very nervous that she had COVID. Didn't know if she could even get anywhere to get tested because she lived in the South Metro area of the Twin Cities. And just like, I definitely don't want to go in the cities because this was happening during the rioting and during the uncivil arrest with George Floyd. And so she was just nervous, and obviously she was still working because she called about it a Friday at like a 4 p.m. And I was like, I don't know what else might be available, but let me take a look here for you. And so I went under our resources, and our resource staff has been working significant amounts of time just trying to keep up with all the changing information during the pandemic. So they've been doing such a great job keeping the I looked up the COVID testing sites, and I actually found 4 or 5 places for her to stay in her area that did, weekend times and after 5 p.m. And she was just so grateful. She was like, I didn't know this existed. I didn't know that 211, could point me in the direction of where I needed to go to get testing. And so she's just kind of ecstatic with like how she could find more resources. And she's like, I'll definitely call back. And I'm like, good. We're here all the time. So it was great.
Mm-hmm.
I want to just add something onto that, because I've talked with the Minnesota Department of Health and their COVID hotline, and they actually have been referring people to us, which is where we look to see what testing sites they're on, is on their website. So it's kind of a mutual beneficial thing for both agencies.
Yes. Well, and I think that's a good example too of, 211 does really vet our sources. Certainly we want to make sure that we're sharing CDC guidelines or the Department of Health official kind of messages or resources, testing sites, et cetera. And so especially in a time like this where there are, lots of sources of information, lots of, miscommunications or things that we might have to help myth bust a little bit. We're that trusted source of information too, to be able to help make sure people are adhering to facts and what we know as at least state policy and other resources, especially when there's so much information flying around left and right. That is certainly something that we take very seriously too, is really making sure that the resources that we share are vetted or from very trustworthy sources, as well as, working directly with nonprofits in our database to get their personal updates about their own programs on a regular basis so that we can have the best information possible.
Which keeps us accredited for the National Association.
That national accreditation is wonderful to have and high standards to maintain. So we're pleased to be accredited, and just wrapped up actually this month. I believe we got our official plaque that we accomplished our accreditation, and so that was a long effort, but we're so happy about that. So yes. Jackie, do you have a story to share, maybe to a different example of a call maybe that has stuck with you from this past few months?
Yeah, there's a older gentleman that called me. This was in the early days, this pandemic, and he didn't have transportation to go to his local food shelf and get out. And he was obviously very anxious about getting food. So, we talked about, did he have anybody that could go and help him get food? He was saying, no, he didn't. I said, well, let's check and see what your local food shelf is if they ever do any deliveries. The information that we have in our database did say that they didn't say that they did deliveries. So what I did is I said, if I can take your name and phone number, let me do a little more research and let me call you back, see what I found out. And we'll kind of just take it from there. And he was agreeable to that. So I did speak with his local food shelf just to confirm they weren't doing any deliveries. They were, of course, having a hard time adjusting because a lot of their volunteers were people who were in the vulnerable categories, so they had limited resources too at that time. But they did mention that if he could get somebody to come for him, they had a process for doing that. It requires some documentation stuff, but they could do that. And then I also called another nonprofit food shelf called Community Emergency Services. Most people just call it CES. And I asked them if they ever go outside of their service area. And they said that they were actually talking about doing that because they were trying to work out how they were going to handle, their food shelf during the COVID-19. They did say that they would call him and that they would get him food. So they took his information. I called him back, told him that they would be calling him that day or the next day and that they would be able to bring some food to him. I also shared with the possibility with this local food shelf. And fortunately, during the time that we first spoke to the second time, he said, I think I have somebody who might be able to help me by going to his local food shelf. So, did a little more advocacy on that call than we might do on most calls, but it turned out we got the service that he needed in a critical time for him.
Mm-hmm. Yes, thank you. Well, and I think that, just exemplifies how so many, challenges are compounded during this time. And, even when people were getting by with a visit to the food shelf, it just has really just made things all that much more complex and complicated. And so a lot of calls continue to come in with related kind of issues that maybe wouldn't have been an issue a year ago.
Right.
Mm-hmm. Raylyn, do you mind? We talked a little bit about kind of what a typical call exchange is like. Can you give us a little better sense of kind of what is your day like? What do you do all day, or what's it like to be on the phone and interacting? What does that kind of day-to-day look like for you and your teammates?
Yeah. So a lot of us are staggered because we are 24/7. So a lot of, we don't have the regular 9 to 5 schedule that everyone else may have. But I come in at 10 a.m. and I leave at 6 p.m. But Jackie comes in earlier. She leaves by 4:30, right, Jackie?
Well, 4 now.
4. Yes,
Yeah.
that's right. We changed our time, so I got a little confused. But yes, so we all kind of stagger our start and end times, but that's so we can get coverage for those service levels for those calls that come in. And so with the pandemic, it's been a little bit more different. We did have a triage team helping us take calls, and then we'd call those participants back once we found the information that they needed. But yeah, typical day would be, we'd log in, answer our calls. We have set break schedules, so we all have to take our breaks staggered again so that there's coverage. And then, there's chats and texts as well as calls. So we do also take in those, and we take those as they come in. So if there's a call that's before that text message, we'll take that, and then whoever may be open for the next, call would be the person to take that text message instead of getting back in the call queue. So yeah, very, very good, very busy lately, but definitely helping the community out has been my favorite thing about doing what we do here. So
yeah, wonderful. I know it's a lot of juggling, a lot of different things that you all do. So that's great. Thank you for sharing.
you're welcome.
And Jackie, you've been doing this for a very long time. You can share if you want. But what kind of keeps you motivated and keeps you coming back each day to work?
Well, I've actually had my 10-year anniversary on August 4th. And I don't mind sharing that because I'm very proud of it. You know, the ability to help people, even if there isn't a viable resource, you can still talk to people. They can still feel heard. People will even thank you, even if there's there's nothing out there for the particular need that they're calling for. And that, that ability to help people and to connect with the community and feel a sense of being part of something larger than yourself, I think that's what kind of motivates me to come back every day.
Mm-hmm.
Congratulations on 10 years, Jackie. That's amazing.
Thank you.
You're welcome.
Yeah. And Raylyn, how about you, just as we kind of wrap up, what motivates you each day to keep coming back?
I have to agree with Jackie. Just being able to help, and sometimes, I mean, you get those calls that they're really hard and they're crying, or, they're really in a desperate place and they don't feel like they have any hope. And just giving that person, a hand up, or, just giving them the hope that they need to continue to move forward and drive, motivate themselves. A lot of times when people call in crisis, they forget about their own personal support, or, even family or friends, individuals that they forget about, and it's nice to just kind of think outside of the box and give them a different, problem solving strategy. So I get motivated by helping others as well, just like Jackie said.
Yeah.
Great. Well, thank you both so much for joining us for this today.
You're very welcome.
Yeah, thank you.
Thanks for having us.
Yeah, and we'll have some Q&A at the end too. So if you think of any questions that you might have liked to ask Raylyn or Jackie, certainly feel free to put those in the chat as well. So quick note on the voicemail question I see in the chat. Lynn was referring to a voicemail in that that was kind of our emergency mode during the peak of that call volume, as we would leave people a voicemail. So usually that's not our practice, or we'd have them call back. We'd call them back instead of answering the question on the first call. So that was more of a kind of emergency coping mechanism and not typical for our call center. So with that, if we go on to the next slide, we're going to dive into an example now. So, we've talked kind of about the broad response during the COVID-19 pandemic, as well as the experience of our callers and kind of community resource specialists. Want to look closer at how we've used the data, what we've seen in the data, and how that's informed some of our work going forward, in the area of housing. Next slide. So this is a breakdown of the broad umbrella of basic needs. So that's comprised of housing and shelter, utilities, food, material goods like household goods or clothing, and transportation are the kind of broad basic needs buckets. And then each of these, the blue versus orange or yellow, I guess whatever color those are, the blue is 2019, the orange is 2020. So you can see that kind of year over year, this couple month window, year over year, an increase in housing related requests, utilities, and food significantly. And obviously utilities are very interwoven with housing. It's definitely a related need. So housing and shelter is where we'll drill down a bit more. If you can go to the next slide, please. So if we look at the subcategory of housing, we track a lot of layers of data. So this could get broken down even more, but there's more data within 211 than we know what to do with sometimes. But this hopefully breaks it down in a way that is manageable for this type of conversation. We have rent assistance is one type of housing resource, as well as shelters, so homeless shelters, and kind of a catch-all other, and then mortgage assistance. So of these kind of subcategories within housing, as you'll see, rent assistance really stands out as a huge increase from the type of requests that we would typically get in March and April. And we know that a lot of these requests are pandemic related, with the record unemployment requests, with the way that housing is so intricately tied to your health and safety as a family in a pandemic situation. There are a lot of requests for rental assistance. That's been something that really stood out to us as a need and kind of an alarm, to be honest, as far as how are we as a community going to respond to this. And this is not going to be easily resolved. Even in a kind of normal times, rent assistance is one of the most challenging resources to get access to, or to really help refer somebody to, because it is a kind of decentralized system. And so it's hard to know exactly who has funds available for what type of need and at what point in the month do the funds run out. So rental assistance calls are some of our most challenging on a normal day. And certainly in this environment, it's continued to be a real stress for families and a challenge when there just aren't always community resources, or especially when it comes to funds to actually pay that bill. Those funds are not sufficient for the need that we have right now. I will add, for those of you, probably most of you are aware, that there is a housing or a eviction moratorium currently. So in the state of Minnesota, through Governor Walz's peacetime emergency orders, nobody should be evicted from their homes. I know there's, nuance there, but in a nutshell, there is an eviction moratorium. So that's the good news, is that there's some protections there for people who might not otherwise be able to pay their rent, but that's also not a permanent solution or something that is going to necessarily make some of these families whole for, months and months if they're getting behind on some of those payments. So with that, if we can go to the next slide, please. Want to highlight a few things that 211 and United Way have done as it relates to that data. So as I said, we were definitely concerned seeing this real increased need for rent assistance and understanding the environment and circumstances of the pandemic. So certainly looked at the data in a deeper way, looked at it by geography. This is not just an urban or metro need. This is certainly statewide. Obviously, there's, half the state's population is in the metro, but we're getting calls from all over the state for the same type of need across many different counties, across Rochester, St. Cloud, definitely a broad need in our state. So really looked closer at that, as well as then to look at how can we share this information? Who needs to know this? Who can do something about this? So we shared information with Minnesota Housing. We shared information with other local housing groups and organizations to really try to help sound the alarm a bit, if you will. As well as, one thing that's really unique about 211's data set, especially in a circumstance like this, is, our data is based on, basically daily, every day, 24 hours, overnight, our data updates. So we have near real-time information from real callers who are self-identifying their needs and concerns and questions and bringing them forward, and we're tracking those. So 211 is a fairly unique data set when we think about the type of responsiveness and the kind of type of perspective that it's capturing. And it is statewide, so we're getting a really interesting look at what's behind this. And so I know, especially in that mid to late March, a lot of the data that was out there was retroactive. It was a report from February about unemployment claims or some other kind of static document. And so 211 data was a precursor in a lot of ways, and I think was helpful to share that as widely as we could. Also, in particular, in that case, we shared it with the legislature. So our SVP of Community Impact, Akua Ellis, testified before the state legislature and cited some of this data to show what our concerns were. Housing is a big part of our advocacy agenda at United Way. And so we were able to share this information to bring it to policymakers who could hopefully help pass some legislation or funding for these needs in our community. Eventually, as you hopefully have heard, Governor Walz has said, made available through the CARES Act funding, that there is $100 million available for Minnesotans who are behind on rent, mortgage, or utility assistance. That is going to be made available soon here, and we're excited to have helped in any way that it might have helped to kind of advance that work and to raise that issue and help people make the case to say this is something that we need in the state of Minnesota, because we know so many of our neighbors are impacted in this particular moment. And then finally, one of the things that we're really excited about is we are partnering with the Minnesota Housing Finance Agency to help streamline access to those funds. So United Way 211 will be, not yet, please don't start calling our lines just yet, but next week tentatively will be the access point for people in the general public to be able to call and find out, do I qualify or not for some of these funds? So that is a central access point we haven't had necessarily in this in our state in this way before. And so to really make it as easy as possible for somebody to know where to call, where to turn, who can help answer my questions about this, knowing that this is a pent-up demand, knowing that there is excessive, just so many multi-layered needs out there, but that rent assistance is such a pressing issue for so many people. So that is something that we're excited to have a role in, and to be able to help however we can to really leverage that, as I said before, that statewide infrastructure that we have, that we can leverage it in a way to help people get access to some of these other resources in our community that are available. So that is, in a nutshell, kind of our content. But if you go to the next slide, we do have some things for you to consider. So one more slide. For those of you who've stuck with us this far, thank you so much for joining us today. And we would love for you to consider participating in any or all of these ways. First of all, for those of you who might not be familiar with 211, please visit our website. 211unitedway.org has a lot of great information there, or certainly call 211 for if anybody you know, or if you personally might need access to some resources, or you might be wondering about what's available out there. We do have a broad variety of topics and information available. So please know that 211 is your resource, it's our community resource, and we're here for you and anybody who might need to call. So please utilize that service. On our website, you can go through a guided search. You can click through different types of needs, resources that you're looking for. So if nothing else, go check it out, familiarize yourself. It's always great to maybe know about it before you need to utilize it. Second of all, please consider joining our advocacy network. As I mentioned, housing is a really key pillar of our advocacy agenda at Greater Twin Cities United Way. We have an action alert that we'll send out, or other updates about legislative issues or advocacy. So if you want to make your voice heard, kind of join that network, you can get updates and partake and get some tidbits of ways that you can participate in that. So please consider joining that group. And then finally, spreading the word. As I mentioned, we will often hear that I never knew about 211, or I didn't know you did that. So if you learned one thing today, please share it with a friend or a family member, somebody in your quarantine bubble. If you have, something that struck you or that is new information, please feel free to share that. Also on our website, you'll see there's a header or whatever that is, a link to click to order materials. So if you're part of a nonprofit, you work at a school, or you are active in your place of worship, there's a lot of resources we have that we can have physical pamphlets or whatever mailed to you as well, so that you can help make sure that that resource is available for people that might be coming through or otherwise be able to share information about 211. So know that there's ways to spread the word, and we're happy to have you all as part of our kind of network to help get that information out. So with that, if you go to the next slide, I believe it's time for Q&A.
Thank you, Julie. So at this time, we're going to be transitioning to the Q&A, as Julie just said. So Isabella, are there any questions that are currently in the chat box?
Yes, there are a few questions in the chat box, and Julie did answer one of them earlier already regarding callers being sent to voicemail, so thank you for that, Julie. Let's see. So the first question I have, maybe either James or Julie would be best to answer this. Is there a way for partner agencies to communicate information to 211? For example, a new program or client-facing service that a certain agency would like 211 to promote to callers?
Mm-hmm. Yes, so you can always call 211. That is probably the easiest to remember way. If you call 211, just let them know that you're calling on behalf of an agency or that you have some information to update, and they'll get you in touch with our team who manages that. Otherwise, on our website, you'll see there's a For Community Service Providers tab as well next to that order materials link. So there'll be more information there about different ways that you can update your information, or if you're a brand new service that's not in the 211 database already, a way to provide us your information. So that would be the most simple way to do it. We certainly appreciate that because we know things are changing all the time.
Did we lose Julie there?
I believe we did.
Okay.
I think Julie you lost, but I can help answer some questions.
Okay, perfect. So the next question is, do you have any connections with the culturally specific agencies helping the communities? And how do you deal with the culturally specific need?
Oh, good question. Absolutely. So, our resource, our kind of referral database, our resource database has over 40,000 resources, right? So as callers call in and make requests, our staff like Jackie and Raylyn really seek to understand that caller's needs and match them with resources that make sense, right? We also have, we partner with a language line that provides translation services, as well as we have a few folks on staff who are multilingual Hmong and Spanish speakers. But Jackie or Raylyn, would you like to add anything else to add for that question?
No, I think you nailed that one pretty well, James. You're right. We do accommodate with Language Line. So we have a partnership with them. And if they say that, they need Somali, or I've had Karen call in, different languages. And so we accommodate with that, and we make sure that the interpreter understands, they're very professional at Language Line. They keep it to what we say, and then they just reiterate what we say to them back in their own language, and then we go back and forth. So it works really well.
Yeah, and the recognition, right, of culturally responsive, culturally contextualized services too, right?
Right. Exactly.
There are sometimes we have like ethnic food groups or food support, that are specific for different communities. There are some other things that are just for like Hmong elders. There are, so it depending upon what they present with the need and what information we can, maybe tease out more information, just specifically what they're looking for, then that helps us to search in the right manner to find that resource.
And we do have agencies in the database that are culturally specific. So there are plenty of those as well.
Mm-hmm.
Perfect. That was one of the next questions, but then I'll move on to the one after that. What sort of housing resources do you provide for people? Do you set them up with a county housing assessment or refer them to organizations?
All of the above, right? So as Julie shared and as Jackie and Raylin shared, housing is really a core part of the request that we get, right? It's no secret that Minnesota is facing a housing crisis in kind of every form of housing, whether it's people experiencing homelessness or people at risk of experiencing homelessness, or keeping people in their homes, such as seniors in their homes, and avoiding any sort of housing instability at various levels, right? So all, Jackie and Raylin can speak to it, but they, seek to understand that caller's need and then match them with the resource. We do have partnerships with a few different counties to provide specialized services, to provide an intake to what they call coordinated entry, which Julie is our lead with some of that work, but that helps get someone started down the path of receiving county services if they are eligible for those services. So at this point, I may pass it over to either Julie or Raylin or Jackie to provide a little more context for some of the housing work.
Yeah, I'm back. Sorry to disappear. But yes, you summarized it well, but yeah, so there are instances where we might do that kind of screening tool or other type of a setup to actually get somebody down that path and started on that path. Otherwise, it typically, especially in the areas outside of housing, we're usually referring somebody to an organization that might be able to assist them. But I don't know, Jackie or Raylin, anything to add?
Well, we do with Ramsey County for families, we do a pre-screen for their coordinated access system, and we send that information. We get permission to do that and send that information to them, and they follow up with the person. We also do for St. Louis County in northern Minnesota. Yep. We do just a little bit of information from them, and then we set up an appointment for an assessment. And that's basically kind of what we do on that. Once they go through the assessment and we set that up, they contact that agency or that individual that they're with, once we've done our bit. So, Raylin, do you have anything else to add to that?
No, you got it. So
okay.
Good.
And it's hard to, and this question's hard to have one answer because, as Julie shared earlier, right, the housing system, as many social services, it's a really fragmented system, right? So, it's not a surprise that we get a lot of questions about where to go, how to get in touch with resources, how to access resources, what am I eligible for? Because quite honestly, it is an incredibly complex system. And so, that it's hard for us to provide one simple answer because it's far from a simple system.
Well, it's also interesting too, because people call and they say, I was told to call you. And that's how they start off the conversation. And then it's like, okay, who told you to call? What did they say? Right. Did they mention doing a housing assessment? Did they mention the word SPDAT or VI SPDAT? And nobody knows what that stands for, Right. But beyond the two agencies that we help out with doing those, starting that process, I mean, if people are calling for other areas where we don't do that type of service, we look for agencies in their area that do the coordinated entry, right, so that we're still, pointing them and getting them in the right direction.
Yeah, and every county is different. So whether it be a homeless outreach team that does that, like Washington County, or we do the Ramsey County for families, but Ramsey County also has for youth and single adults. So then we send them to the right venue so that they can get that assessment done and that housing need met.
Great. What else do you have, Isabella?
Yes, so the next question is, in what ways is 211 accessible for folks who may not have their own phone? And how do most people seem to learn about 211 as a resource?
Mm-hmm. Yeah, that's a good question. So we certainly have multiple channels available. So, there is the website for self-service. There is texting if people prefer to text than talk. We have online chat and obviously calling 211. So all of those require at least a phone or internet access. So that's, I guess baselines one way or the other, or borrowing somebody's phone is probably what happens most. A lot of people will call on borrowed phones or a public phone of some sort from a lobby or some other public location. So we try to definitely be as accessible as possible. We do attend community outreach events, or we used to. Those don't happen very much anymore, but we would often go out to, whether it may be a job fair or a health fair or different community events, different kind of local resource fairs with nonprofit partners, trying to connect with people at a table or other type of a format. We do community presentations or other types of trainings as well. So those are some of the other ways that maybe not as much right now, but certainly have employed, and look forward to getting back to doing more of those things as well.
Every great once in a while, thinking about people who may not have phone access, every great once in a while, I will have a letter in my mailbox here at work from someone who is in a correctional institution, right? Who is in prison, and they reach out mostly when I read the letters because a social worker may have told them about 211 and they're preparing for their reentry. And so in those cases, I forward that to the team who responds in writing. So that is written responses are the exception by far, but they do occasionally happen.
Mm-hmm. And then to follow up on the second half of that question of how do people usually learn about 211, I think, a lot of it is word of mouth, or kind of coming across it at a community center or in their library or in a place where maybe we have some posters or flyers. We've advertised to an extent, not as much on a public marketing front, but trying to provide information to healthcare providers or faith leaders, different groups that might often interact with school teachers is another example, groups that might often interact with people. They're natural points of contact where people might seek out resources or support. And so if we can help them know about 211, then they might be able to pass it on when somebody's looking for additional support. So trying always to get the word out, but certainly would be interesting to do a fuller analysis to see where people are kind of coming through.
Earlier this year, thanks to the generosity of Wells Fargo, we had an advertising campaign with Metro Transit. And so that actually happened over the month of February. And we were, as we walked, I think as a community into March, we were grateful for that opportunity to have increased awareness in February as we moved into obviously a new season of experiencing community needs. So if we have any Wells Fargo folks on the phone, thank you for that support.
I want to just point out a couple things with the question about if someone doesn't have a phone. There are the federal lifeline phones. So if somebody is borrowing a phone, they let you know that. We can tell them about that and how to access that, and what the eligibility is. There are also some agencies that do a community voicemail, which would still mean they'd have to get access, to the internet or to a phone to pick it up. But at least like if they are searching for a job or something while they're waiting to get one of the lifeline phones, they could be picking up voicemail and as a way of contacting. So that's part of the troubleshooting and thinking outside the box and knowing your resources. So I hope that helps.
Yeah, that's a great example. Thanks, Jackie.
You're welcome.
Perfect. Our next question is, let's see, is there any role for volunteers in the work that you do?
Well, that's something we're exploring. We don't currently have volunteer, like permanent or, formal roles, but we're definitely considering how we might be able to do that. And in particular, I think the needs of the pandemic have highlighted the potential need for that backup capacity or additional support. So certainly something on our minds, but nothing specific right now.
Okay. And our next question is, are there any South Asian agencies that you know of? I know Sarun was able to provide 2, CAPI USA, and another one that I'm not familiar with. But are there any that the resource specialists are familiar with that you have been able to provide callers with?
Well, and quite honestly, I would refer that question to call 211 and ask. The Jackie and Raylyn, obviously, well, all of us have access to the resource database, and two, you on our 211 website, you can look it up. But I would love to, there are actually quite a few South Asian agencies here in the Twin Cities and beyond. So give 211 a shout and explore.
Perfect. Okay. And the next question is, does 211 capability exist throughout the country?
So yes is the short answer. US and Canada. There are some states that have, don't have 100% coverage in every county. So every state has a 211, but they might be geographically, focused on a metro area or a certain portion of the state. So there are technically some resources or some geographic areas that might not have 211 coverage, but I think it's like 96% of the country's population does have a local 211 servicing their area. So pretty much yes.
I'll just weigh in here that we do have a website that we can go to and look up for other 211s, because we do get calls from outside of Minnesota that are looking for services, and we have to direct them back. And sometimes we do have to tell them there isn't something in that area. I had one the other day. They were North Carolina, and they did have a 211, but North Carolina had told them to call us even though they were looking for resources in North Carolina. And she told me what resources, and I said, we did some little brainstorming, and I was able to give her a possible lead. Even though I don't know anything about resources in North Carolina, it was like a general kind of thing. Do you have an agency like this? Try checking with them. And she was going to try her local 211 back again. But, she was kind of in a circle and feeling anxious and upset. So, try to help her out.
And when you think about 211 broadly, there are people that call 211 for questions for themselves, and people that call 211 for someone on behalf of someone they care about, whether that is whether they're a social worker and working with a person or a family, or maybe they're a teacher or a faith leader, or perhaps sometimes you think, oh, why would it cross state lines, or those sorts of things, right? And there are a number of situations that arise where someone may be calling and asking about services for an aging parent, right? They may live across the country, but their mother lives in St. Paul and she might need Meals on Wheels. And those sorts of questions are actually quite common to help figure out opportunities to serve our community, even in ways that you might not think of at first.
Okay, our next question is, besides housing, what are some of the other most common requests from 211?
So, like I said, housing is our number one request, but we have a lot of requests for utilities, which is very closely related. And then mental health resources are another big, I think our second most popular request, or popular, but our second most frequent request. So that's another significant area where we have referrals. And James, is there, I feel like there's one I'm forgetting. Oh, I can't remember right now.
Mental health, food. Food is a big community need. And occasionally we have, some of the other ones that stand out, some of the seasonal requests. So occasionally questions for tax prep services, school supplies, seasonal meals, those sorts of questions come up. But really, food, housing, healthcare, mental health, the broad-based social services.
Mm-hmm.
We also get, people calling. They have dental pain, so they're calling to see if there's any free dental emergency services, medical clinics that might be free or sliding fee scale. We get calls. I have a complaint about a company, for consumers. So it might be a legal referral. It might be to the Attorney General. We've had a lot of calls of people on unemployment not being able to get through during this pandemic. And what do? We've also, like James said, like school supplies. There's the Give Kids a Smile program starts in January, at least as far as making appointments. So there are some of those, very specific seasonal kind of things that come up too. But I like to tell people, if you're not sure if 211 has it, call us. We'll let you know if it's not something we do. I'm not going to have your local pizza parlor. But if you work there and you lost their number and you're going to be late to work, I'll look it up for you.
And another nice thing is our database allows us to search with filters. So if someone has medical assistance and they need a clinic that would take medical assistance, we can actually filter out every other community clinic that would not take MA, and we would be able to give them those specific resources. So it's pretty amazing what the technology can do for us.
All right, the next question is, how is 211 helping with the needs identified around food?
So yes, one of the things that has come out of this pandemic is, like I said, the need for food delivery and helping people get to a food shelf in a safe way. So we have a couple of programs or initiatives around food specifically through a national partnership with Lyft, the rideshare company, as well as DoorDash, the delivery company. And so we have a program right now where we're working with DoorDash and several of our United Way's food shelf partner organizations to help deliver food and meals to people's homes. So that's something we just kicked off this month to help kind of centralize some of that coordination on behalf of many organizations in the community, so that we can have that delivery service available that maybe one organization wouldn't necessarily be able to maintain at scale on their own, but collectively we're delivering, hundreds of packages of food supplies to people's homes every week. So that's something we're really excited about, as well as a partnership with Lyft to help people get transportation. We're helping provide rides to a food shelf in some cases, or to a housing intake appointment when those were in person. There's several ways that we're also helping with transportation needs as well around access to food. So a few things that are specific to this environment.
Perfect. And our last question is, what do you wish more people understood about 211?
I would love to hear Jackie and Raylynn's responses to that question.
That's just thinking.
Jackie, you want to go first?
Well, the thing that pops into my mind about that is that I wish when people refer to 211 that they explain why or what we do, because we spend a lot of time, trying to figure out why they're calling us because they haven't been told, or explaining what we do. And I know not everybody's going to do that, but that would certainly be something that would be helpful, and let the person have an understanding of who they're calling, because they're anxious when they call and they don't know what they're going to get.
Right. I piggyback with Jackie on that one. That's a major, because like you said, that's valuable time for them to find the resources correctly, and then also valuable time for us to serve our community by having to go over what we do, and instead of someone asking us directly for financial assistance, which is not what we do, you know, we can get them community resources that connect them to financial assistance, but not directly that financial aspect. So that would help so greatly that we could just, you know, cut that middle line out and just let them know, you know, there may be resources. We just need to look for you. So
Yeah. And I think what Ray just touched on, because people will call and they'll say, I was told to call 211 and you guys can help me. And implying that we're going to give them money for the rent or,
Right.
you know, whatever the need is. And that's not what we do. And so sometimes when people have been given number after number after number and they call us and they say, you're just going to give me a number, aren't you? You know, and you feel so sorry, but that's what they do. That's what we have to do, you know, so you
And
work with them.
Yeah, I think that kind of gets at the heart of something that I wish people would know or understand is I think, you know, I think our old name, that first call for help, was maybe descriptive in some ways, because I think what becomes a challenge is when somebody has tried every door that they can find, or, you know, called everyone that they can come across, and then as a last resort contacts 211, and either we have the same resources they've already tried, or they just feel like there's just, you know, more, it adds to a hopelessness feel when you keep getting kind of turned down that way. And so I wish people would call 211 first and say, you know what, before I kind of go through this exhaustive process, I'm just going to call 211, and they can tell me if half of these are a waste of my time. And they can give me the 3 agencies that might be best suited to address this question I have, and I'm likely to qualify, and then I can just focus on those. I think that would be one thing I would add, kind of on top of that type of a circumstance that pops up on a fairly regular basis.
I think that's a really good point, because I will have people call and they will say they've been given a list by a specific agency, and it's multiple agencies throughout the area, and they've been told that they should contact this agency, and I know they're not in their service area. So these agencies are either not checking that list, or they're not putting down that eligibility or service area. So these people are making multiple calls, you know, to no avail. So, but I also have people call and say, well, I always call you guys first. So there are people that do that, Julia.
Good.
And I think just to close it out, from my point of view, what I wish people knew about 211 was simply that we're here, right? That we're available. And
Yes.
so to what Julie said earlier, spread the word, tell your friends and family, tell your neighbors and your coworkers that A, we exist, and B, we want to help. And thank you, Anthony and Isabella, for facilitating today, and to Julie for leading us through the information, and Raylan and Jackie, thank you for the work that you do every day, and thank you for sharing your time with us this afternoon.
You're welcome. Thank you for having
You're
us.
welcome. Yes, thank you. Thanks for being there as our backup.
So once again, in closing, I want to thank all the panelists, staff, donors, and community participants for joining us today. It was excellent. A video link of today's session will be included in the newsletter that we send out monthly. Our next Community Connection Series event will be 80 by 3, which will be held on September 16th from 1:30 to 2:30 p.m. So I'd like to end today's session with a commitment to live inclusively. I commit to be intentional in living inclusively. I commit to spending more time getting to know myself and understanding my culture. It is in understanding myself that I am better positioned to understand others. I will acknowledge that I don't know what I don't know, but I will not use what is unconscious as an excuse. I will be intentional in exposing myself to difference. If I don't know, I will ask. If I'm asked, I will assume positive intent. More importantly, I will accept my responsibility in increasing my knowledge and understanding. I commit to speak up and speak out even when I'm not directly impacted, for there is no such thing as neutrality in the quest for equality, justice, and inclusion. I will strive to accept, not just tolerate, respect, even if I don't agree, and be curious, not judgmental. I commit to pausing and listening. I will be empathetic to the experiences and perspectives of my others. I will use my privilege positively, and I get comfortable with my own discomfort. I commit to knowing, getting, and doing better than I did yesterday. Keeping in mind, my commitment to live inclusively is a journey and not a destination. On behalf of the Great Twin Cities United Way and our panelists, thank you. Have a great day.